The gentleman from Vermont is recognized for 5 minutes.
I thank the chairman. Mr. Chairman, this amendment is co-sponsored by Mr. Davis of Illinois, Mr. Hinchey of New York, Mr. Tierney of Massachusetts, and Ms. Baldwin of Wisconsin. Mr. Speaker, today we are talking about bioterrorism and how to protect the American people against this nightmare. And that is an appropriate subject of discussion, something the American people want us to address. But we must be frank and say that if, God forbid, this country was ever subjected to a major terrorist attack in terms of biological, chemical, or nuclear weapons, we must admit that we currently do not have the public health infrastructure to deal with such a crisis. This bill contains many important provisions to fill that gap, and I support those provisions, but it still leaves a very large hole. 44 million Americans have no health insurance or any primary care physician, and tens of millions more are inadequately insured. In the event of a national medical emergency, where would these people turn for medical assistance? How, in an orderly and effective way, would millions of people receive the medications and medical care they need on the same day? In my view, the United States government must make certain that every community in America, in our large cities and in our rural small towns, have a public health capability for treating all people, regardless of income, regardless of geographical location. It is inconceivable to me that we can talk seriously about addressing the nightmare of bioterrorism without addressing the issue of public health infrastructure. We can have all the medicine we want. We can have all the vaccines we want, and we must have that. But they won't do us any good if there is not a public health infrastructure to make sure that that medicine is adequately and effectively distributed, and that all people are able to get the health care that they need. And that will not be easy. Mr. Speaker, Mr. Chairman, this amendment begins to address that problem by providing $100 million in additional funding for federally qualified community health centers. The good news here is that we are not reinventing the wheel in this area, because FQHCs have already shown in urban areas and in rural areas that they can provide quality health care to all people at a very cost-effective rate. FQHCs already exist in every state in this country and are widely recognized as doing a great job. They have widespread support on both sides of the aisle, and from President Bush and Secretary of Health and Human Services Thompson. The only problem is that there are not enough of them. And if we are serious about protecting the American people from bioterrorism, we must build more. The bottom line is that every American must know that in the event of a national medical emergency, there is a public health place that they can go to get the drugs that they need, to get the health care they need. That does not exist now. And in my view, by expanding the community health center program, we can go a long way in making that access available to all people. So, Mr. Chairman, I think that this is an important amendment. It is widely supported, and I would hope the membership could accept it.
Gentleman from California.
We very much appreciate the brevity of the gentleman, and with that, we have no objection to the amendment.
Gentleman from Wisconsin.
I have no objection on this side of the aisle.
Mr. Speaker.
Gentleman from Illinois.
Move to strike the last word.
Gentleman from Illinois is recognized.
I simply appreciate the fact that this amendment is accepted. I commend the gentleman for introducing it. Community health centers do, in fact, have the infrastructure in place, and I think it's a great amendment, and I appreciate the chairman and the ranking member for accepting the amendment.
Question is on agreeing to the amendment of the gentleman from Vermont. All those in favor say aye. Those opposed, no. Opinion of the chair, the ayes have it. The amendment is agreed to. What purpose, the lady from New York rise?
Mr. Speaker, I have an amendment at the desk.